Today's question is there any reliable way to detect ankle instability by using some functional test? One example of such a test is the anterior drawer test, and you are probably familiar with that. We give a counter pressure anterior, we grasp the heel and we do a translation movement in anterior direction and we assess mobility. Is it hypermobile, yes or no? Of course you compare with the other side. In case there is any hypermobility, then we can think of a rupture of the anterior talofibular ligament. Is this test relevant? Well, the good news is, according to an article I came across, if we perform that test in a standardized way, then it seems to be pretty reliable. But of course, in literature, many other tests for instability are described. And according to literature overview, unfortunately, many of those other tests are not reliable, so it doesn't make too much sense to perform them. But then the question is there another reliable way to detect instability in the ankle? And I came across to another interesting scientific article in which they describe two radiological procedures. First procedure is doing the anterior drawer test under radiological control, and then they measure the distance between two specific dots, as you can see on the picture now. And then you can objectivate, is there an increase in distance, yes or no? And the second procedure was doing the general ligamentous test. Remember, contact medial, plantarflexion, adduction, supination, a combined movement, and then also see what happens in the lateral aspect. And as you can see on the picture again, then you can clearly see that we can measure a certain angle, and if this angle is too big, then we have a suspicion that something happened on the lateral side of the ankle, more specifically a ligamentous rupture.